I'm confused here. Last week, the CDC shortened the quarantine time to 5 days, no test to get out of it. Now, Dr. Fauci says you should be tested to get out of that quarantine situation. That's confusing. What's going on here?
It is confusing. It's confusing to the public. It's even confusing to us doctors. I had to read the guidance a couple of times over before I understood it. So it's enormously hard to understand. The testing to get out of quarantine or isolation is a terrible idea. The PCR test can remain positive for weeks, even months after a positive case. The antigen tests, the home tests, are less reliable, and they're in short supply. Even if the government comes through with these hundreds of thousands of kits that they're promising, the kits are still in short supply. My patients are having trouble finding them. And then to have to use the kit to get out of quarantine. So now you're testing to go into quarantine and you're testing to go out of quarantine. That's doubling the number of tests that are going to be needed. And I think that's just going to cause more confusion. Also, you can have a false positive test on these kits with other strains of coronaviruses like the common cold. The common cold is caused by other coronaviruses. So you can have just a regular cold and test positive on these things.
That's just such a mess.